Well, good morning or afternoon, class. We are so happy to have with us today Lindsey Cervantes. Lindsey is an MSW, LCSW social worker who works at the City of Hope doing medical social work. So I hope that you will take some great lessons from her and allow her to talk about what she does and why she does that. So thank you, Lindsey, for being with us and for being available to be interviewed like this. Appreciate it.
Absolutely. Thanks for having me. Hi, everyone. So I'm sorry I can't be there in person today, but I appreciate being able to talk to you guys about medical social work and what I do. As Professor Brown said, my name is Lindsey. I'm a social worker at City of Hope Medical Center. It's just up the 605. It's a cancer center specifically, cancer and diabetes center. And so I have worked there coming on 6 years this December. I graduated with my master's from UCLA in 2014. And then I started working at a community hospital just in general medical social work, something called per diem. So it's kind of like part-time. I worked on the weekends. They would call me if someone was out sick, and I would just help cover. So I just kind of covered all of the different units and then started working at City of Hope that December. I actually graduated from Whittier College in 2012 with my BSW and then went straight into my master's program. And I chose to do a 2-year program just because I wanted more internship experience, and I was going straight from college that I wanted just to get a little bit more experience and wasn't in a rush to get into the real world yet. So I've had a couple different roles at City of Hope. And I'm currently an adult social worker that I work with our lung cancer patients specifically. And I'm kind of developing a program to provide what we call disease-focused care. So really figuring out what people who have lung cancer need versus other types of cancers, and seeing where there's some overlap with just a cancer diagnosis and what's specific to lung cancer. I've also worked with our what's called GI cancers, so like colon cancer, rectal cancer, those kinds of cancers. And then I've worked on the pediatric oncology side, mainly with sarcomas, so like bone cancers, soft tissue cancers, things like that, which tend to be adolescents and young adults. So kind of from like 15 to maybe 30 tend to get those cancers. So I've worked with the whole age range at City of Hope, but again, always within cancer since starting here. So I knew that I wanted to go into oncology social work in, I believe, college, maybe even high school. I taught swim lessons as my summer job, and I had a student who had leukemia. And when I was asking him about what it was like at the doctor's office and just kind of talking to him, he said that there was this one person and he just kept saying her name, and he was 5. He didn't know what she was or who she was, but I asked his mom and it was his social worker. And that really stuck with him, of just someone who was fun and really normalizing to him. The way that he was describing her just made the hospital feel less scary, just more normal. And when I was talking to mom about it, she just raved about the social worker and how calming she was to both the little boy and to the whole family, and also worked with the siblings. So it just really made me interested in what an oncology social worker does. And then I looked more into it and then ended up just falling in love with that field of social work. And so pursued that pretty much from the beginning of when I started with my BSW program, knowing that that's kind of the direction I wanted to go. So I think the part of what I love about oncology social work is that no matter, I think we all know, you've learned about different family systems. People often say that families can be dysfunctional, right? And every family has their own dynamics that can make them really complicated, but there's something really special about working with a family during some of the most stressful times of their life when a loved one is really ill. And whether that's something acute, so something that happens just suddenly, or a more chronic illness, and they've been going through their cancer journey for a while, the family often seems to rally around that person, no matter how complicated the family system is, no matter how many different conflicts there are that day. When that loved one needs the support of the family, oftentimes, and there's exceptions to every rule, of course, but oftentimes they just really rally around each other, and I can support the family as a whole and work within those dynamics. But I always find it just to be a really kind of beautiful time to join a family during that. And it's always amazing to me that families who have never met me before let in a total stranger into their family system to support them and help kind of guide them and understand what they're going through. And it just always feels like such a privilege to join them in that. But I think one thing that I really struggle with in social work in general is I think so many of us go into this field of really wanting to help and make a difference. And there's times that we're not going to. And really getting used to that and being okay with that. And it can be for so many different reasons. Either someone might not be ready to kind of welcome support or help. They might not want it. And just because we look at a situation and feel, oh, I can really help, that's very much, I have to remember my bias of what I think someone needs or wants, and not necessarily what they need or want in that moment or maybe ever. And also knowing that sometimes it's not a right fit, where I might really feel like I could support someone, but they just don't feel that same connection. And that's absolutely fine. But it can be a really hard reality to accept of like, okay, they need a different social worker, and that's okay. And let me connect them with someone that'll be a better fit for them. But I think just accepting that I'm not always going to be able to help someone make a change that they're looking for, get that support, it's a tough pill to swallow sometimes. And then I think advice that I would give you guys is my biggest piece of advice is try a lot of different things. I knew that I wanted oncology social work, but I actually never had an oncology social work internship. I felt very strongly that I knew what I would like about it. So I wanted to see, almost kind of rule out other options. And so for my BSW, I interned at East Whittier City School District. My first year internship at UCLA was in an inpatient psychiatric unit. And then my second year was at a community agency at the Alzheimer's Association. So I still was kind of within medical, but really just trying to explore my options. I also did an internship within a human resource department just to really see, is social work even what I want? And every time there were things I liked about each time, but every time it just drew me a little bit closer to knowing, okay, medical social work and specifically oncology is what I want to do right now. So that would be my biggest piece of advice, is try everything, have internships, volunteer places that put you out of your comfort zone, and also volunteer places that really guide, like fill that need of what you're looking for. And then be gracious with yourself. If you think you always wanted something and you don't love it, that's okay too. It's okay to change your mind. I always wanted pediatric oncology. I did it and I loved parts of it, but I knew that I wanted to get back into the adult world. And it was hard to accept that to myself after wanting it for so many years. But just try. And then the other piece is to network, to talk to other social workers, talk to other people in other professions, to really hear from them of what do they like about their job? What do they struggle with? What would they recommend? I think you can get 10 social workers or professionals of any kind in a room and get 10 different pieces of advice. And that's a good thing. And then you can really figure out what works for you. What do you need as you're kind of developing in your profession? And you also never know which of those conversations might turn into an internship opportunity, a job opportunity. I got my job because someone at my dad's job in HR knew the director of social work at City of Hope. And I reached out to her for just what I called an informational interview, because I just wanted to know, how can I get into oncology social work? And she was lovely and warm and wonderful. And at the end, she said, "Hey, we have someone going on maternity leave in a month. Do you want to cover her 6 months cover her for 6 months?" And of course, I jumped at that opportunity. I had just graduated, and it just all kind of worked out. But if I hadn't reached out just to pick her brain, she never would have known I was even interested or existed even. So just keep on networking. It can feel awkward, but people in the field understand it and have been there and want to help other people going through that. So really be a little bit shameless with talking to people and saying what you want and don't want. That's kind of my biggest piece of advice.
Great, great. Thank you. Um, so I want to conclude our interview just by thanking you, Lindsey, again for taking your time and being real honest and sharing kind of what your journey has been as a social worker. I think those pieces of wisdom, advice were really, really great. Um, I guess if I have one question, it would be, um, you were you able to see what other medical social workers do who don't work at City of Hope in a hospital setting? Is there anything different than at the job that you're doing at the place that you're
Yes,
doing?
really, really great question. So when I worked at the community hospital, it was Providence St. Joseph's in Burbank. So it's just a hospital that anyone can come to with any kind of aches, pains, illness. So I spent a lot of the time in the emergency room, which it's not a trauma one center. So we didn't get a lot of major traumas like major car accidents, just kind of traumatic events, but we had a lot of psychiatric concerns. So people who are coming in with hallucinations, delusions, a lot of substance use. People were coming in high or drunk and really trying to assess them and help connect them with resources. Sometimes putting them on what can be called a 5150 hold, a psychiatric hold. So that's one piece is really that helped me sharpen my assessment skills of really kind of seeing what's going on with someone, what kind of support they need immediately and ongoing. Because it's a community hospital, we also had a lot of people who were homeless coming in. And sometimes it was that they were coming in and they had been in an accident. And so maybe they were unconscious or maybe they were psychotic. Same thing with psychiatric illnesses. And so we would have to really do a little bit of investigating to try to figure out who they were, contact family. And then people would come in with diabetes that was just untreated or uncared for. People would come in for just general surgeries and need help getting connected to insurance, or financial support, financial resources. Sometimes they're not safe living at home anymore. So it really, medical social work has a whole broad range. You can specifically focus in on an illness like cancer. In children's hospitals, there's often social workers that specialize in cystic fibrosis or spina bifida. There's a whole different, like, again, range that you can specialize in illness, or you can just do general social work. And then if you're in a trauma one emergency room, it's more of the constantly like addressing end of life or life altering accidents or changes. And it's a really just fast paced environment. So it hits the whole gamut. But if you ever go to a hospital, there's likely at least one social worker. And so you always know that there's someone there that can help support that person or their family, both emotionally and practically. So there's a whole range within medical.
Great, great. Thank you for adding that. And just for the class, you cannot be a medical social worker with a BSW. You have to have an MSW to go into the medical field and do social work. But as you can hear from the kind of situations that Lindsey is talking about, we need some of our most trained and most dedicated people out there working with the people who wind up in the hospital needing a social worker.
Yeah. Thank you for saying that. And if I can do a quick plug, you cannot be a medical social worker as a BSW, but we do always have a BSW intern. So just know that at Whittier, we have partnered with you guys. So if you guys are ever interested in that, oh my gosh, I'm so sorry.
It's okay.
Coworker is
This is
calling me
the
on
world.
MS
This
Teams.
is the world of Zoom.
Yeah,
We're all in it. We're all in
exactly.
it. Phones going off, dogs barking, all that stuff. We're all in it together.
So true. But yes,
Well,
just please know that we do have an intern, but you're right. You do need your master's to actually work in the medical field.
great, great, great. Well, thanks again, Lindsey. I appreciate your time. The information is valuable to us and to the students. And if you don't mind, if they have questions later, I'll let them know that they can reach out via email to you and ask any of the
Yes,
questions, okay?
absolutely. I'm here. You have my contact information, so reach out to Professor Brown, and I'm happy to help with anything.
Okay. Thanks so much, Lindsey.
Thank you. Take care.